This is the Trauma, Resonance, Resilience podcast. And this is for you if you are interested in compassion, connection, and relationships, and how we can all work together, creating services that do not add to harm, but rather seek to support recovery from it. I'm your host, Lisa Cherry, and this is your time to sit back and listen in on conversations that make a difference. So here we are on season 2, and this is episode 2. And I'm really mega uber excited, which of course, as you know, if you listen, I always am very excited. But this is really exciting. And I tell you why. I was on holiday and I'd asked Twitter if it would give me a range of fiction books to read. And I'm not a big fiction reader, so I need all the help that I can get. And I was given so many different books to read. And one of the books that came up was A Good Enough Mother by Bev Thomas. And I read through the whole book. I couldn't put it down. I absolutely loved it. Got to the end. And it turned out that Bev Thomas is a clinical psychologist in the NHS for many years, currently works as an organisational consultant in mental health and other services, living in London with her family. And this was her debut novel. So I did what all people do. I wrote to her on Twitter and said, will you please come on the podcast? Bev Thomas, welcome to the podcast.
Thank you very much. It's very exciting to be here. Thank you.
Well, I mean, the book was so layered, actually, that I don't even know really where to start. And I did wonder how, if somebody who didn't work in public sectors would pick up some of the layers. I did think about that. So I'm going to start with just reading a little bit about when you first came across your new trainee.
Yeah,
who you have a slight disdain for,
Stephanie.
Which I think you, Stephanie, yes, bless her. And so I'm going to start with her, really. When I read her student report, I saw a high achiever, a first from Oxford, and, just like me many years ago, the offer of a place on a clinical psychology training course after only a year of work experience. But I also saw someone whose previous 3 placements had been in cognitive behaviour therapy. She had no experience of our therapeutic approach, and reading her personal statement, it was hard to fathom her reason for choosing her specialist placement here with us. As I took in the neat, symmetrical bob, the manicured nails, I realised Paula had been wrong. It was anxiety, not eagerness, that was her motivator. Towards the end of our meeting, I tried to find a way about asking her about the papers. They were good, she said. What did you make of Melanie Klein? I persevered, knowing how most students struggle with the density of her writing. Really interesting, she nodded blandly. Thanks very much for sending them. And that's when I understood my irritation. It wasn't the fact that she had gaps in her understanding and theory, nor was it her avoidance or capacity for denial. It was the fact she thought her performance was credible, that somehow she believed she had fooled me. Now, why I'm starting there is, of course, that the main character spends most of her time fooling herself really beautifully. And I just thought that has got to be worth unpicking. But the first question I'm going to ask you is how much of you was in that book? And I bet everybody asks you that.
Yeah, it's really interesting because it is my debut published book, but I have been writing for a very long time and I haven't written before about my work. So it's really interesting that this was the one that got very quickly snapped up. I was very interested in bringing a world to life that I feel very passionate about. So in terms of the world, in terms of the model of therapy, which I don't think has kind of been in many kind of brought to life in that way in many novels. I mean, I wanted it not to be sort of at the sideline. I wanted it to be right at the heart of the novel. So there's lots of novels where people go to therapists and that's a bit of the book. But I wanted that to be the drama. I mean, I was really passionate about that, and I'm passionate about the model. So I kind of wanted to bring it to life in a way that people could read and think, oh, you know, I mean, one of the things that my agent who took me on said, I learned so much reading this book. And she's not somebody who's interested in going to therapy, but she said, I learned such a lot. So that was kind of like, oh, great, that's what I hope for. So, I mean, I think, in answer to your question, there's a lot of me in the world, bringing in the world to life, but I had to find somebody who had I didn't want the patient or client to be the kind of main character. And that, I think, is the thing that had stopped me setting a novel in that world, because I didn't feel equipped to do that. So as soon as I suddenly thought, what if it's the therapist that's traumatized, and flipped the whole concept, that the kind of idea really opened up. So in terms of, is that me? Have I had a missing 17-year-old son? No. Did I have twins? No. I think that my interest was finding a character that I could explore some of my thoughts about, some of my thoughts and learning, I guess, about the world. And so I suppose, one of the feedbacks have been it's very authentic, which is great, because I suppose I have worked in that field for quite a long time. And I am also very interested in, how do therapists, counsellors, nurses, doctors, how do they look after themselves? And I think that the reality is that we often see them as sort of perfect and infallible beings. And of course, they have other lives, often very crumbling lives themselves. So it was a kind of area that I was really interested in exploring, is how do people balance that kind of personal and professional dichotomy, really? Because you can be performing very, very brilliantly in one part of your life and disastrously in another. And there's nothing wrong with that. But I think what I wanted to show was this sort of perfect storm in this book, when those two worlds collide, when it starts off and she thinks she sees her missing son in the waiting room.
And I think you do that so well. I think that's one of the strengths of the book, because through using her as the character, you have an opportunity as well to be that internal voice and dialogue with what's going on for her, which I thought was very clever. So, for instance, in her own supervision, we are party to her ability to decide what she's going to share and what she's not going to share, which is not something, that's that kind of the subconscious and the unconscious and the conscious all meeting. That's not something we would normally have that opportunity to unpick. And I think because you used the character in that way, we were able to see that, and how she knew that she was crossing a line, and how she knew that there was something uncomfortable about the boundaries. And we got to see her internal world around that.
I think it's hard to really talk to many people in a professional role who have been practicing for maybe 25 or 30 years, who haven't felt the pull to cross a boundary, who haven't, I'm not saying they have, but, it would be unusual if people haven't found themselves in a situation. I've spoken to teachers who said, yes, I probably went over and above what I should have done with that student because they reminded me of blah, blah, or because I felt desperate for them. I think many professionals not just therapists, get pulled because we're human, So I suppose I was very interested in kind of exploring that. And as you say, that the first person narrative is fantastic for that kind of inner world, isn't it? That she is showing what's going on, but there's a kind of, is it reliable, is it not reliable, what the reader has to make their own decisions about or come to their own conclusions about the decisions she makes. I think one kind of initially fairly small error leads to a kind of snowballing of other kind of fairly disastrous events. But the decision to see him then and there and not refer him on, I don't know. I've had interesting discussions with other people who've said, I'm not sure I would have referred him on, so it's not clear cut,
Yeah, and I loved that, because everyone will read that and they will hit their point, which is their boundary. So I knew really clearly in my mind when she had crossed the line, and that was when he was in her house, and I was like, whoa. What's going on there? So by the time he'd kind of moved into being on her staircase,
spoiler alert, we have to stop there in case spoiler alert.
Sorry. Yeah, I know everyone's going to read this, don't worry about that. So I think that ability to kind of really see where, for each reader, where was the point where you kind of went, whoa. And that's really interesting of itself, isn't it? Because we all have, there's the professional line that we think we have. And then, of course, we have our...
Oh, just one second. Oh, it's fine. No, it's fine. You have to edit this bit out. My son forgot that I was doing this, so he's just let the dog out, but he's now taken the dog back in.
Well, I think we won't edit it, and I'll tell you why. Because in the spirit of the book, of being in the realness of life, these things happen. So that's fine. We'll just completely humanise both of us in this whole podcast process. Exactly. I've fobbed Milo off with a long walk and a dentist stick, so I'm hoping he's going to be very quiet for us. So there's that whole kind of, where do the professional and our own personal, because that's not clear cut, is it? You speak to one person and they have one view about where that boundary might lie, or the boundary might be quite nuanced, but the consequences were so major. I mean, how did that feel writing it? Did it feel quite uncomfortable as you progressed into this quagmire of what was to come?
I mean, obviously every writer writes differently, but my process of writing is to be, I often have the final paragraph written very early on, so I know exactly where it's going. And obviously I won't say what that is for the viewers or listeners, but so it's a process of kind of knowing where I start and knowing where I'm ending, and then kind of working out the middle bit. So I'm very clear where it's going. I mean, a few things happened along the way which are unexpected, which of course makes the joy of writing what it is, really, that, I'm not a kind of big mapper outer of stuff, but I have a sort of a sense of what's the question I want to ask, because it's such a long journey writing a book that if I'm not interested in answering the question myself, why on earth would other people be interested in reading it? So the question for me was something around that, that split between what does it mean to be a good mother? What does it mean to be a good therapist? Where are the boundaries of both, really? So, and I think making her both of those things, of course, then sort of enmesh the two things together in a way that I feel that if you come from that background, then you're answering questions or thinking about that for yourself. If you don't, it doesn't matter. You're looking into somebody else's world, which I also love doing. I love picking up books, that I remember I read a book about something that was it's not at all to do with anything I'm familiar with, and I thought, I've really learned about such and such a profession that I wouldn't have done before. So I guess whether you're a mother or not, most people have been in some kind of family, so there are issues around parenting, about siblings. There's obviously a big issue about her having twins, and she treats the twins are very different, but as a consequence she treats them very differently, and I think that's often quite interesting.
I think it's often quite something that happens. I mean, because of the dynamics of the way that you interrelate with your own children, whether they're twins or not.
Absolutely.
That, and so I think there's something there that's really a good pull for people to connect with.
When I did work as a clinical psychologist, I often saw in my consulting room the Carolyns of this world, i.e. people who perhaps had siblings who were quite troubled or quite difficult or had disabilities or mental health problems. And so the Carolyns of this world are the ones that often might seem to be fine, but actually are struggling later on. So it's not always clear cut. So I suppose I was quite interested in drawing that out in the book. So obviously there's the key scene when she tells her mother, the therapist, that she's seeing her own therapist, which is the sort of biggest grenade that she can chuck at her, really, isn't it, in that moment? But so I think that, I'm glad it's multi-layered. That you said it's multi-layered, and I was very interested in, I guess, part of working with people, and now I work with teams, is that there is so much layering. There's the sort of what you hear on a concrete, rational level, and then there's, that's what's going on behind that. That's what might be motivating that person or that team, and they may not be aware of that. And I think that's really fascinating. That whole process of what people's awareness are of what's going on and what isn't. So as you say, she's kind of in a state of denial. She kind of knows what she's doing, but I think that's the other thing that I think is really powerful. I think grief is one of the most powerful emotions, and I think that we probably, can get driven to behave in ways that are not rational, because this is a mother who's really grieving and she doesn't know where her son is. And I think that sort of all rational, practical thinking can easily go out of the window. And that's what I wanted to focus on as well, is that actually sometimes you can be she can have held things together for all this time, and then a thing happens and it sort of blows everything out of the water.
But also, I think if you do get caught up in that scenario, the external voices from a loved one or from a family member or from a really good friend, they're the things that can pull you back round, aren't they?
Yeah.
You know, and help you kind of see beyond this irrational relationship that, and that comes across a lot, except that she wasn't able to really hear that from anyone else. There wasn't really a space for anyone else to support her in that. And I wonder, was that a deliberate, or was that just how the story kind of unfolded in your writing?
Well, I think that's true. And I think that she has, to some extent, and I wanted to portray her like that, she has to some extent quite isolated herself in many ways. And I did quite a lot of research into missing people, missing kind of older children or adults. And I think it's very poignant and quite heartbreaking research, really. But I read about quite a lot of people whose lives were kind of on hold, you know, waiting to hear. What sets missing people apart from, you know, I'm not saying a bereavement is easy, but a bereavement has a kind of end to it, was this kind of ambiguous loss. So you actually don't know what's happened to that person. And I think that some of the stories were really poignant because there was the kind of caught up slightly obsessiveness, because you can't grieve, you can't really kind of let it go. And I was quite interested in that. And I think so for her, she is a person who has had a very kind of enmeshed attachment with him anyway, with her son. So him going missing was never going to be easy. I mean, I don't think it would ever be easy, a child of 17, nearly 18 going missing. And of course, I deliberately set him at that age. So very quickly he becomes an adult in the eyes of the law. So therefore, you know, there is very little that can be done. So there were terrible sort of sad stories about that. But I think it is, I can't imagine how one would cope with something like that, because it is a sort of never-ending ambiguity. There is no sort of end to it. So I guess I also wanted to paint a portrait of somebody who had kind of isolated herself. She was performing brilliantly at work, but she didn't really kind of have many friends. I think there's a kind of allusion to the fact that, you know, a lot of people couldn't really kind of bear that was all that was going on for her. So in fact, it was a sort of, she's kind of retreated herself as well. The marriages come to an end. You know, that there's lots that make her, what's the word, you know, all the ingredients there for this sort of problem to happen. Does that make sense? Whereas, as you say, I think if people are very supported, and perhaps, you know, it doesn't mean that it's any easier, but I think she's a bit like a sort of untethered boat, you know, with this.
I mean, thinking about her own trauma and what she brings to the party, her inability in a way to detach herself in any kind of meaningful way from her son across the years, it looks that's what comes across, that there's a whole heap of other stuff going on for her. And I'm wondering, I didn't get a full sense of where that had really come from. I guess there's just only so much you can unpick in one novel, you know, but what was your feeling about that? What do you think led her to be so, to in a way be kind of quite codependent with her son and his needs?
Well, I think although it's not explored, you know, too much in there, I mean, absolutely the codependency comes from her relationship with her own mother. So we learn that her father left when she was small. Her mother is an alcoholic. So she became the kind of primary carer for her mother. So I think that kind of level of codependency was started very early on. And I think in some ways I wanted to, I mean, she does sort of allude to it a couple of times, you know, she was so, her own identity or her own kind of individuality was slightly stamped out by her mother, because her mother had mental health and other needs herself, and had an alcohol problem, which meant that she didn't have the kind of capacity to think and mother Ruth in the way that Ruth needed to be mothered. So I think Ruth talks about wanting to ensure that she had a different experience, gave a different experience to her children. And in a way, paradoxically, I think that her desperation to do that means that she does the opposite. which I think we can all relate to. You know, you try so desperately not to do X and you end up doing X. So I think that in some level, she was so in tune. Well, this is my idea behind it. She was so in tune with her own misery and anxiety when she was a child that seeing it in her son, who also did have, you know, she didn't kind of make him conjure up, you know, personality-wise, he was definitely more anxious and had more worries than Carolyn did. But in some ways, I think that was so unbearable for her that she had to kind of eradicate it. You know, she couldn't bear it. And literally, I guess one of the parts of being a therapist is bearing very difficult feelings in the room. And I guess part of the journey for all of us in motherhood and parenting is bearing that our children aren't always going to be happy. And that's really tough. And I think that because of her own background, she found it too tough. So in a way, she didn't bear it. She tried to jolly him out of it. She tried to get him to be somebody he wasn't. And I think that's the key thing. You know, actually, he was quite clearly somebody who liked to be in certain places and was drawn to certain things when he was younger. And at some level, she kept on trying to push him to be this other sort of boy. You know, the desire to fit in. And I guess that is very prescient at the moment, isn't it? You know, in our kind of society, how do we manage difference? How do we want kind of people to just fit in with the norm, be like everybody else? And I think that she falls foul to that, particularly because she has such high anxiety stroke memories of being very unhappy herself.
And that's so interesting because I'd forgotten about Ruth's mum. That dynamic really resonates with me, and I'm curious about how I managed to just completely forget that bit, because that resonated on such a deep level in that mother-daughter cycle, actually, and how to kind of manage that, holding that anxiety around, you know, one of my children. I recognised some of that in the writing, but also what that brings up in you when you also have had to manage the anxiety of the mother and how that kind of works. So that's probably why it felt so poignant for me to look at that. I mean, you could have done an entire book just on that alone. And I guess as a therapist, you know, that's that kind of intergenerational trauma, if you like, and how that plays itself out is something that you're working with all the time. It's not always anyone's fault, and that's the thing when we're thinking about trauma, that people get quite caught up in. They want someone to blame. That's what the book offers, is that kind of, it wasn't really anyone's fault, but the ingredients were there for it to play out.
Yes. Absolutely. No. That's you've. I mean, it's such a great way of putting it, because I think that one of the things that has come up at events is people asking me, well, what do I think it was? Who's to blame? Is it him or her? Or, you know, and I said, well, I don't think I was interested in writing that sort of book. I'm interested in layering something out, and it's really for people to decide or think. You know, I think there is no easy answer to any of the questions I think I'm trying to raise in this book. You know, I don't have them. I don't know anyone who does, but I do think it's fascinating. And I think you're absolutely right that if only we had a little something we could bottle and say, well, this was my experience and I'll shake this bottle and drink these drops of that and I won't pass it on. I mean, if only, you know, I think what I'm interested in is how it does roll out, and how even if you are aware of it, there's a kind of whole unconscious process that can roll out.
Oh, yes.
Exactly.
Oh, yes.
It's not easy, is it? Yeah. You know, partly doing this work, as I'm sure you know yourself, is that it isn't black and white. It's not clear cut. And I'm always sort of much more interested in the sort of grey, murky stuff, and trying to find that, finding a way of exploring that in fiction was the sort of dream.
I love the grey, murky stuff. And actually, that's a real amber nectar in the current world we're living in, that actually wants things to be this or that. And taking people into a place where there are no answers, that actually things just are. And what we really want to do is build more compassion about that. I mean, if you'd have lingered on Ruth's mum, then everyone could have blamed Ruth's mum's alcoholism, but actually, what would have the point been? Because she would have had a whole set of experiences that would have taken her to the place that got her to be dependent on alcohol or whatever. So I think anything that fosters compassion about the fact that we're actually, as human beings, we're all just rocking up trying to do the best we can. And that in the process of trying to do the best we can, we also have this capacity to get things terribly wrong, and to recreate the same patterns through trying to avoid the patterns that came before.
Absolutely.
I think that was my biggest devastation as a parent, really, because I just had it in my head that if you just kind of loved enough, and you just kind of were present enough, and you just kind of knew enough, and you just kind of connected enough, everything was going to be okay. And of course, it isn't really like that. And there's something about having got children to adulthood that really supports a much deeper compassion, not just to me and to them, but to every parent, who's just doing their best. And maybe it's easier if you don't know half of this stuff, actually.
Obviously we won't say what happens, but I feel compassionate about all my characters. And I think that my hope in the book is that I gave all of them sufficient backstory so that the reader does feel compassion.
You did, Bev. You really did. I mean, especially the character that is the front page headline. No spoilers. I'm trying really hard, but
he's a tricky character. We learn about him in the first page. He's a very tricky character, and he's had a very difficult time. But even in a smaller character, Stephanie, you mentioned, who has this sort of tense, slightly combative relationship with Ruth. We lay to her very small nod to what her family story is with a child with disabilities, and her way of coping is to be very kind of brisk and black and white, and she doesn't like all the pain of uncertainty. We all get that. So I guess I was really interested in characters that were sort of fully formed, so that we could kind of read them and think, I see, I'm not sure I would have done that, but I could see why they would have done that, or I feel bad for him, or so that we understand them. It doesn't mean we have to like them all, but I think my aim was to try and draw characters that really made psychological sense.
I think you really pulled that off, and you kept it, I found it layered enough for me, but I think, for the lay person, also being able to kind of maybe feel compassion towards that character.
Yes.
Because we don't have a history of that. We don't have a public space where we have unpicked certain very hideous crimes committed by children, for example. As a public, we haven't unpicked those things and had the conversations that we needed to have about, what happened for those children, for them to get to that place. We just don't.
I remember reading, it was a while ago, so it's a little bit hazy, but I remember reading Blake Morrison's book, As If, which was
I've read that.
Child. And, it is really fascinating, because in there he talked about when really bad things happen, and I think I refer to this a bit towards the end, but, when really bad things happen, we kind of want to understand and get it so that we can say, great, so that's nothing to do with us, or, that's over there, that's understandable, and it won't, and of course that would be great, wouldn't it, if we could all do that. But the reality is that, and he talked about that so brilliantly in the book, that, there wasn't, there often isn't something that you can say, look and see what's happened, because you could find someone else who that very thing has happened to them and they haven't gone and done that. So it is I'm really fascinated by exactly that question. And I think that, we like to, society, it's kind of neat, isn't it, to sort of package up, because I think the end product is that it reduces our anxiety. Kind of think, okay, there we go, that happened because of X, Y, and Z. Oh, well, that's not going to happen in my house or in my city or in my, country. So therefore, I can rest a bit. And actually, if we really confronted it all, it's all really anxiety, the uncertainty of not knowing some of those things. So, I didn't want to write a book that was so kind of airy-fairy and not pinned down. So I am very clear about some things in the book, but I also putting it out there for people to say, well, you think, what do you think? What would you have done differently? And what do you see how it rolled out? Again, with the one that I'm writing now, I feel like I've got to have a question that I want to answer, a dilemma for my character, in order to sort of invest that level of time and commitment to spend on it. Otherwise I get bored if I'm not answering a question myself, if that makes sense.
Yeah, absolutely. And I suppose just thinking on a more macro level, really, around anxiety, because anxiety is something that we talk about extensively now. I mean, I remember suffering terribly with anxiety, but I mean, I would never have had a narrative for it.
Yeah.
I didn't know what a panic attack was. I didn't know why I woke up sometimes and didn't know what day it was, or any of those things. And yet now we have a really big dialogue about anxiety, which I'm not sure if it's alleviated anxiety, to give it to label it, or whether it's enhanced it. I don't know. But certainly we're much more aware of the general anxiety that people feel just kind of being alive, and how so much of that is about how we reduce that. And some people are very much politically, I think, political commentary really understands this anxiousness and utilizes it as best that it can. I mean, what are your thoughts around, well, any of that really, where we are with the anxiety conversation, how that's playing out in the bigger picture? Do you have any thoughts about that?
I mean, I think it generally feels like it's a societal, it feels an anxious time generally. And I don't work as a clinician now, but I know that many of my colleagues have seen some of that kind of macro level anxiety being brought into coming into the consulting room in a way that perhaps wasn't sometime before. I mean, in my work with teams and organizations, I think there's a kind of ongoing anxiety around resources and direction in lots of the public sector, which I think is really difficult, because on a ground level, there are people trying to often doing incredibly brilliant work in a system that is a little bit shaky, or a lot shaky. So I think that makes some sort of macro stuff, makes the sort of in the moment stuff much more difficult to do. And I think that when people are, I see teams that are all stretched, and I think that makes it very difficult to go back to what you were saying before about to have compassion. So what teams get caught up in is does this person fit my sort of referral criteria? Oh, great. Phew, no, it doesn't. And then it gets bounced to some other team. Does this person fit my, oh, great. No, we can get rid of them for these reasons. All of which is kind of understandable, because they're all so stretched and overloaded. But the problem is the person in the middle of that doesn't really care what criteria or what referral system is going on. They just want to be seen and need help. So, and I think that for the clinicians in the middle of that, it's really difficult, because that's what they came in to do the work for. They didn't come in to be having kind of political conversations about referral systems. So I think it's a really tough time, in terms of public sector work, at all levels. I think people are being pulled out of roles. So what they might have been doing, I talk a lot to teachers, and teachers were doing one thing maybe 10 or 15 years ago. In many different boroughs, they're doing a bit of social work, a bit of teaching, all sorts of things, aren't they? Counsellors. So I think roles are being kind of stretched outwards. And I suppose there's a chapter in my book where I'm very interested in exploring that. Obviously it fits in with the kind of narrative of the story, but the character goes to work with a team, and I'm trying to highlight a real difficulty about the consequences of the shortage of mental health beds, and what some of the consequences are about that. So while telling a kind of story that turns pages, I'm also trying to explore stuff that feels very prescient and that I feel quite passionate about, really. So and I guess at the end of the day, those climates make holding risk really challenging. Yes.
And that kind of, if there's one thing that's going on in this whole book, it's that how do you hold that risk? Where do you sit with it? And that's holding risk as a parent, and holding risk as a
therapist, as a team, you know, and I think that's one of the things that I think is for the people that I do work with now, you know, I feel full of admiration that that's what they have to hold on a daily basis. And of course, the more referrals, the more stretched, they have to hold more of that, you know, and it's really tough. I think it's really, really tough. So I guess that's also, yeah, as you say, that's a kind of big theme in the book, is that how do we do that? And how do we do that? You know, when people say mistakes get made, it's not so much mistakes, is it? It's kind of when people are at capacity, you know, how do they manage? And I think that obviously my character is a character who is at full, if not more, capacity. But also I think that, you know, in this climate, there's less and less support. You know, she does have a supervisor, and as you quite rightly say, she's kind of economical with the truth about what she brings. But a lot of teams don't have reflective practice or supervision. They just have to kind of muddle on. And that's really tough when things are stretched, I think.
Yeah. So you're busy writing your next book, which is very exciting. Do we get any clues?
Can I just show you this, which just arrived yesterday, which is the paperback, new cover of Good Enough Mother, which comes out in March. And I think they've done a great job, actually, of so it just came through my door yesterday, so I just wanted to share it.
It's fantastic.
Thank you. So I am working on something new, and I feel like I've finally found the kind of question that I want to ask and answer in the book. But, you know, as I think it's I had a meeting with my agent, and she said, yes, it feels like that's your territory, sort of putting out a dilemma in some ways for a character, and sort of rolling that out through the book and exploring dysfunctional families. That seems
I was going to say,
something I'm quite interested in.
Are you staying in your field? Because I think there's a real niche market there, definitely.
Yeah. There is a therapist in it, but in a much smaller role, but it is exploring quite a contemporary, tricky issue. So I feel like I can't say any more at the moment, but again, multi-layered, still seeing if I can pull it off at the moment because it's early days, but we'll see. Yeah.
Listen, I'll be straight down the bookshops buying it, so don't, and you'll be back on the podcast talking about it.
Oh, thank you.
Listen, it's been great to talk to you, and I feel a little bit spoiled. There's something really luxurious about having a deeper conversation with the author about what might have sat underneath stuff. So Thank you so much for responding.
Oh, no, it's a pleasure. It was really lovely talking to you. So thank you for inviting me.
You've been listening to the Trauma, Resonance, Resilience podcast with me, your host, Lisa Cherry, brought to you straight from the heart of the knowledge that high-quality relationships are the cornerstone of learning, healing, and growing. If you've enjoyed this episode, please consider sharing or reviewing. Until next time.